Well, ladies and gentlemen, we are back for our second episode of Leaders at the Table. I am excited. I'm always excited, but more so excited that Dr. Gray is here with us. Dr. Sheena is here with us. This conversation is a conversation around chronic diseases and communities, tackling colon health. So we want to start this conversation, as we always do, with introductions from our guest. Let's kick it off with Dr. Gray.
I am Darrell Gray II. I have the pleasure of being a husband of almost 15 years, father to 4 amazing children, a physician. By background, I'm a gastroenterologist and a physician leader. So I get to serve as the CEO of a Medicaid managed care organization locally in Maryland. So one of the other honors, and I really speak in this capacity today, as co-founder and board member for the Association of Black Gastroenterologists and Hepatologists. We are an organization that's a couple of years old, but have grown rapidly, now serving over 500 people, particularly in our membership of gastroenterologists and those who support GI health, particularly in Black communities. And I am so honored to be here with you today.
Thank you so much, sir. Dr. Sheena.
Thank you, Dr. Gray, for being here. And just a quick intro about myself. Backgrounds from born and raised in Kuwait. Came to the US for computer science. I could code, it was in my DNA. Ended up utilizing that and discovering a protein doing my bioengineer degree at the University of California, Santa Barbara, a great dual, hybrid PhD program. And then been in the healthcare of combining the best of both worlds. How do you take great technology using digital health and as well as building amazing products and programs and deploying it through the platform? So really made it my career to learn quickly and reach people that need healthcare no matter where they are.
One thing I would like to dive into first, I feel like this is a conversation amongst friends. Dr. Gray, you're a physician. How did that journey start for you?
Well, I'll tell you, I was fortunate. I grew up in a household with a mom who is an educator, a special needs educator actually in Baltimore City and Baltimore County schools for over 30 years before retiring. And I grew up in a household with a father who was an internal medicine physician. And I had the opportunity to see the impact that he had on people in the community and in his office, both in times of sickness and in wellness. And when I traveled with him on the medicine wards or into the office, I was just kind of in awe. And I said, I want to do that. That's the kind of impact I want to have. Those are the kind of relationships I want to foster. And so the spark was lit very early in my life. And I think as I kind of progressed through high school onto Morehouse, my Morehouse brother Cornelius on the call here, and beyond, it was really fostering that passion and love for the sciences and kind of leveraging that spark to really light the passion further and materialize that into a career. I feel very blessed to be able to do this, but that spark was lit very early in my life.
Sheena, so I'm gonna popcorn it over to you. PhD, Goa, India, Kuwait. How do you go from Goa, India, Kuwait to the US and say, I'm gonna get a PhD? Like, where does that come from? How did you get there? Tell us about it.
I don't think, in those moments you just know your path. Like sometimes you're just like, this is where I'm going to go to the next country and move to the next country. I do believe God creates the pathway, and we're all as leaders here today to come and do the great work. So I feel my path was built there. I just needed to execute and do it. And Simple Health Kit is the vehicle to go do that work. And I'm a forever learner, so I love learning. So that I think that's ingrained in me. My mom worked in the Oni Kuwait Institute for Scientific Research. So like Dr. Gray, my mom was a major inspiration.
Okay.
My dad was the businessman, and so I think it's STEM. There was some roots there, and I could code. So it's like I can do biochemistry, I can do engineering, and now business to what makes sense in healthcare.
Yeah. Okay. So I just wanted to get a little bit, we're multi-layered, but just wanted to see
Yes.
because that kind of stems to my next question, like, why do you wake up every day to do this good work?
I give a lot of credit to my mom doing a lot of hard work, but I also lost my dad when I was 16, and I just finished my 12th grade in Kuwait, and some of his last words I remember right before Father's Day was like, your sister's a scientist, your brother's an engineer, and like, go do something good. So till today, I wake up with, I know it's hard work, but go do something good. So that is the inspiration of why I wake up every day doing this work.
Awesome. Dr. Gray?
I would say, I have a deep sense of purpose and calling, and that being to create systems that advance whole health and health equity so that others can maximize the calling on their lives by also just leading healthy lives. And so really try to enable people to lead their healthiest of lives and do so through leveraging my talents, my time, and my resources to help accomplish that.
Oh, outstanding. Thank you all for sharing that. So let's do a little deeper dive into some other pieces here in the conversation. So the title is around chronic diseases in communities, tackling colon health. Dr. Gray, you mentioned that you are a gastroenterologist. How do you frame the state of chronic disease in the U.S. and what needs to change to significantly impact the trends in this area around colon health?
Well, to take kind of a 30,000-foot view, what Dr. Sheena knows, what many know are that, hey, we in the U.S., we pay the most for healthcare, but aren't getting nearly the results as some of our wealthy nation peers. And as a matter of fact, the prevalence of chronic diseases continues to increase. And we see that both in adults and in children, unfortunately. And so we have to change course. I mean, you mentioned colon health, and yes, this is Colorectal Cancer Awareness Month. March is Colorectal Cancer Awareness Month. Hence, I'm wearing blue today, Cornelius.
Okay.
Yes. In honor of Colorectal Cancer Awareness Month. But just to provide listeners, viewers, a little more information in regards to colon cancer is one of the leading causes of cancer-related death. As a matter of fact, the second leading cause of cancer-related death in the United States amongst men and women. And it's largely preventable with screening. And so that's what makes colorectal cancer screening so important. And I mentioned preventable, and I really want to bold and underline that word, because to get to the latter part of your question, what can we do to enact change and transform what currently is a trend in the United States as far as chronic disease? One, there has to be a greater focus on prevention and not just management of the chronic disease, right? There needs to be greater engagement of communities and community-based organizations. What I mean is we have to work with communities and community-based organizations to create the interventions to address chronic disease and prevention, but also to implement that and do it in a way that makes sense for people. When I say makes sense, I think about things such as health literacy. How do we put these interventions in context that people can easily utilize, easily understand, and easily share? I think the other piece is we have to really lean into identifying and addressing health-related social needs. And I just emphasized screening just a second ago. Well, how is somebody going to access screening? Or might they have to go into a healthcare center, a primary care doctor's office, or a gastroenterologist's office to get screened? So transportation could be an issue, and that's a social driver of health, for example. And there's so many other examples like that, but we really have to dig in and lean into that. I think the other opportunity we have is, how do we align incentives? Incentives for those who we want to, empower to take preventative medicine interventions easily share, or better engage around their chronic disease management. How do we align incentives for healthcare providers who are working with people, their patients, to do that? And then how do we align incentives with payers, insurance companies, to partner with providers to ensure that we are delivering high quality care and preventative services to people all across the nation? The last thing I'll say here is I really want to dig into a word that Dr. Sheena mentioned, and that was innovation. I think we have to continue to press the envelope with innovation around both prevention, but chronic disease management. And, I'm not going to steal Dr. Sheena's thunder, but I think that Simple Health Kit is doing really some fantastic things with innovation, and also just really leaning in to preventative screening.
Yeah, Dr. Sheena, that's a perfect way for you to just jump right in and talk about
did a layup for me, Dr. Gray.
There you go. Yeah.
Just have to dunk now. Dr. Gray, you said it so eloquently. One, chronic conditions, I'm really passionate about it. And I know I mentioned my dad passed, but it was because of chronic conditions. And I feel the ability for prevention, early detection, identify people, and bring them to the table. And we get that feedback directly from, we work with health plans, we work with the health plan members. What an amazing business to run that's actually making real life impact in that person's life.
Yeah. And Dr. Sheena, I want to emphasize something you kind of really alluded to, which was kind of human-centered design. And that's what I appreciate about some of the work that you're doing. But that's why I think it's critical just in general that these approaches account for, because to the point, Cornelius, where you started, certainly Sheena, you carried it over, Dr. Sheena, you carried it over, this is personal, right? I think we all know someone who's impacted by chronic disease. We may know someone who's been impacted by colorectal cancer. Certainly I know many, but we all have a story to share. And Dr. Sheena, you shared about your dad. I'll share about my grandfather. I never got to meet my paternal grandfather, and that's because he passed when my father was in high school, and he passed of a stroke. This is someone who was employed. He was a former Navy serviceman. He then became a photographer for the Social Security Administration. So he was connected, right? He had kind of means, but there was some disconnect there. I don't know if it was health literacy or what have you, but there was a disconnect where he wasn't accessing the services or didn't have a knowledge around a diagnosis of hypertension that ultimately led to him having a stroke and then unfortunately passing prematurely. This is the story I'm sharing about my family, but there's so many stories, right, that we hear day in and day out of these unfortunate situations and outcomes that can be prevented if we focus on community, if we focus on human-centered design, if we focus on aligning incentives, if we focus on innovation that makes sense for people that we get to serve.
Wow. We're talking about the quality of life for individuals, right? And I mentioned on our first episode, I work on the ground in the community. As you all was just speaking, Miss Lewis just walked by. She was trying to wave at me, and I was like, don't wave. I'm on camera. But because people like Miss Lewis, right? She understands. So she's just coming from the Walmart. I see her Walmart bag. She has Medicaid, Medicare, one of those. But really want to understand, like, why is it important for individuals like a Miss Lewis to get these screenings? Like, what does that help a health plan to understand? Like, what is the business of it? Like, do you just want to do it just for the good of just a human cause, or is there a business case to make that people need to get screenings early? Just really want to just dive a little bit into that.
Let me take the example of colorectal cancer screening. So for colorectal cancer screening, we recommend that average risk individuals, this means individuals who don't have a family history of colorectal cancer, which would make them high risk. So average risk individuals start at age 45. And there are different methods by which one can be screened. One could be a fecal immunochemical testing, so a FIT test like what Symbol Health Kit offers. Another example could be a colonoscopy, where identify and remove polyps, just as an example. And there are other FDA-approved methods that are covered by insurance. The key thing is that by getting screened, you are helping to prevent potentially a worse outcome, which would be things like cancer or even potentially death from cancer. And so as you think about the business case, to go to your question, Cornelius, you're preventing, and I just gave the example of colorectal cancer. I mean, you can take the example of diabetes screening and trying to keep your hemoglobin A1C under better control. You're trying to prevent complications. You're trying to prevent the worst case scenario. And by improving health outcomes, by preventing those things, you are in essence saving lives, but also saving costs.
That part.
That's the case. I think, we, at the end of the day, we certainly want the best for those whom we get to serve, whether from a physician lens, a health plan lens, an innovation lens. But in order for us to continue to serve even more and more people, we want to be able to leverage savings around costs to implement new programs, to do more innovation. That's part of the business case.
Yeah, awesome. Dr. Sheena.
I think Dr. Gray said it well. How can we make it a win-win for everybody involved in the ecosystem? And human-centered design and innovation is at the heart of Simple Health Kit, what we do.
Anything else you all want to highlight in this moment, either about the work that you're doing in community or within your organizations? Just want to open the floor, see if you want to share and let the good people know all the good, amazing work that you're doing.
Well, I'll say, first, again, it's an honor for me to be in discussion with you all. And I'll say that to have a conversation like this in this platform with 3 people, I feel privileged to be in this space, because there are going to be people who see this, who look like us, who are now going to be champions of this information. And that's what I expect them to do, is to take this information and share it with their family members, share it with their friends, share it with their colleagues, around the opportunity to have impact through preventative behaviors, but also better management of chronic disease. I mentioned, this is colorectal cancer awareness month. It's a huge month for us gastroenterologists. So please, I encourage people to dig in. If you want more information about the Association of Black Gastroenterologists and Hepatologists, visit our website at blackingastro, BLACKIN gastro, GASTRO.org, and learn more about the organization, how we serve communities across the United States, and to engage with some of our events.
We're raising awareness for what matters the most.
Well, awesome. Well, thank you both for your time today. I really appreciate it, especially during this month. Thank y'all so much. And we'll see you all next time at Leaders at the Table.